I had one of my patients called it bingo arms. I was like, what's bingo arms? And she says, oh, it's when you do this and you say bingo. The old ladies at the bingo parlor do this. I thought that was pretty ridiculous. Hey guys, this is Dr. Tom Agopian with Agopian Plastic Surgery here in Atlanta, Georgia. Today, I want to talk to you guys about a brachioplasty or an arm lift. People have extra skin on their arms, and that happens a lot as we age, or particularly if you lose a lot of weight, you can then do a great job with weight loss, but your arms kind of stay big. It makes it really hard for clothes to fit. You can't wear shirts with sleeves and things like that. We have a lot of things we can do for that. So if you just have a little bit of extra skin in your upper arms here, what we do is we just do a little bit of liposuction, and sometimes we'll add BodyTite or another skin tightening device to that. And that can be a great way to just provide a little lift to the arms if you just have some extra fat and not much extra skin there. Most people though have a lot of extra skin in their upper arms and they need a formal arm lift or a brachioplasty. So what is a brachioplasty? Well, what it is it's skin removal to the upper arm. Make the incision from the elbow into the armpit and remove all the extra skin. It gives you a nice tight round arm and takes care of the little bat wing underneath the arm. Occasionally people have extra skin in their armpit as well, and so we'll run the incision down onto the chest, and that gets rid of that extra bra skin that kind of hangs out there if you've lost a lot of weight. Some people don't need that. Some people who've lost a ton of weight also need a forearm lift, where we take that same incision and run it onto the forearm. My preference for an incision location is the inside of the arm, so you can't really see it when you're at rest and you're just holding your arm down there. Some people want the incision all the way in the back of their elbow, and that's doable. I don't prefer that though, because when you're walking, people can see it if they're walking behind you, and that's not ideal. The surgery itself works really, really well. It takes about 2 to 3 hours, depending on how much liposuction we need to do. I usually do 360 arm liposuction at the same time, so I actually liposuction the whole arm if you have a lot of extra fat that needs to come off as well. If it's mostly skin, we just do a little bit less liposuction, the cost stays a little lower, and it works really well. But we treat the skin and the fat differently depending on what you have. The surgery usually is done as an outpatient. You go home the same day. You have to wear compression for 6 weeks. And then starting at 3 weeks, we give you some scar strips to manage the scar in the upper extremity. Really well tolerated, pretty low risk profile. Sometimes you can get numbness or have scars. And over time, the skin does stretch back out. So no matter how tight I make it, and I try to make it pretty tight at the time of surgery, the skin does stretch. My most recent patient, I took 6 inches of skin off of her. She had a lot of extra skin and fat. And I measured her arms recently at her 6-week follow-up, and she was 4 inches down. So about 2 inches stretched back out, despite the fact that I took 6 inches off of her arm. It's a great procedure for most people. The risks are pretty low. It takes about an hour. It's really awesome. So it's something I don't think a lot of people talk about. I do a lot of them. I do about 1 a week now, which seems really excessive. I probably do more than most people in Atlanta. It's a great procedure if you've got a little extra arm skin. Take a look at my Instagram. You'll get a chance to see. I'm going to try to post more of these and put them up on the website as we go along. I'm really not great with taking photos before and after, and so trying to get better with that. Hopefully you guys can grow with me and follow my Instagram and see as we come along. Anyway, it's really great to talk to you guys. Please follow me on Instagram. If you're into Reddit, please follow me on Reddit. I'm Dr. Tom on Reddit. Yeah, take care.